And the last 4 months, I can count more than 4 of our political leaders that have come or traveled abroad for medical attention, medics, health care, to seek health care. Number one, Buhari came to the UK and buy. The painful thing is that even when they want to buy, they prefer to come and buy abroad than to buy in Nigeria. Our President Tinubu, you said you built Lagos, and it is a lie. Now that you are the president, ensure you build a sound hospital where you can receive treatment. If you don't want to build it in Abuja, carry it to Lagos and build it. This has to stop, because why our medical sector is suffering is because our political leaders don't patronize. They don't patronize it. They prefer they travel abroad. You see, our hospitals and clinics in Nigeria are not meant for our political leaders. As a matter of fact, they don't patronize it. Even down to the least party chairman or even minister or governors, all of them. And this has been an age-long problem. Yeah, any small thing, any small pakararam, they don't couple to the UK to access medical care, America, even India, Dubai. Now, if this continue, our healthcare sector, that industry, will keep suffering this kwachoko that is suffering. You know, our President Tinubu, you said you built Lagos, and it is a lie. Now that you are the president, ensure you build a sound hospital where you can receive treatment. If you don't want to build it in Abuja, carry it to Lagos and build it. This has to stop, because why our medical sector is suffering is because our political leaders don't patronize. They don't patronize it. They prefer they travel abroad. And we'll have good people. We'll have good nurses. We'll have good doctors. Now, the painful thing or the shameful thing is that as they run from Nigeria to the UK or to America, for instance, or anywhere, they will still meet Nigerian doctors and nurses that will be part of the team that will take care of them or attend to them. So what you define for Sokoto, it did for your Sokoto, according to Nigerians, yeah? Yeah, I guess so this really has to stop. Yeah. And the last 4 months, I can count more than 4 of our political leaders that have come or traveled abroad for medical attention, medics, health care, to seek health care. Number one, Buhari came to the UK and buy. The painful thing is that even when they want to buy, they prefer to come and buy abroad than to buy in Nigeria. We still facilitate their corps with taxpayers' money and their medical treatment. Shit, facilitate back to Nigeria. Why Buhari was here, Abdul Salam Abubakar, former head of state, was also receiving treatments. What happened to Nigerian hospital? These people were president, former this, former that. They could not build a hospital that would take care of them. I'm not all our governors. Wiki, for instance, former governor of Rivers State. I'm telling you, now that you are FCT minister, what are you building? Where is the hospital you're building that you can boldly walk in and receive healthcare treatment? I'm talking about Abuja, where the seat of power, yeah? The other day, one nurse, they had an emergency in one of the hospitals. I think I had it. I shared one of the videos. The nurse was complaining of no hand glove in Abuja, Federal Capital Territory. to attend to a patient that had emergency. It's as bad as that. If that can happen in Abuja, think of what is happening in Osogbo. Think of what is happening in one village in Kebbi. Think of what is happening in one village in Ebonyi State. So, our political leaders are not patronizing our health care, and we need to force them, we need to mandate them to start doing so. If not, our good hands will keep leaving the country to a serious country that value their skills, their giftings, use it to develop their own and their health care industry. So, our political leaders, past and present, need to be mandated. We need to find a way, by fire, by force, to make them begin to use our healthcare, begin to use our clinic, our hospitals. If in each state, as they are building general hospital, they can build the presidential wings where they get the VIP. Yeah, because maybe that is what attract them to overseas here. Build VIP wings for the president, for the governors. I don't know. I'm just saying. Instead of traveling abroad to invest that money in other people's countries. So those of you calling that we should say good thing about Nigeria, all these APC hotches, them, all those their, all those political jobbers. What's good about the country, about your Bodo we talk about when our president, 2 seconds, you don't fly go France. Don't fly come UK for medical health care. What is our governors? Even Ganduje, Akpabio, all of them in these 4 months, they have come abroad for medical treatment. What happened to our hospitals at home? What happened to our nurses? What happened to our doctors? Our healthcare practitioners in Nigeria? So these people don't trust the system. We have to make them trust the system, have faith in the system, and stop them from coming overseas. If not, the kwashiorkor will continue. This is very bad, people.